HIV, or human immunodeficiency virus, remains a major global public health issue. It's claimed an estimated 42.3 million lives to date. Transmission is ongoing in all countries globally. An estimated 39.9 million people were living with HIV globally at the end of 2023. 65% of whom are in the World Health Organization's African region. And as recently as 2022, the Florida Department of Health identified 4,606 new HIV diagnoses. What is our community doing to educate and inform the public? Well, we're going to find out on this special edition of our show. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We're joined by Ryan Sunarine, the Senior Operations Director of the Hope and Help Center, to talk about what his organization is doing for the community. Ryan, thanks for being here.
Thank you.
Tell us a little bit about what Hope and Help is and what it does.
All right, thank you. So Hope and Help is a nonprofit community-based organization. We were founded in 1988, where a couple of friends were taking care of another friend that was dying of complication from AIDS. Those two friends grew into 5 friends, grew into 15 friends, grew into what Hope and Help is now. An organization where our mission is to prevent, educate, test, and treat people with HIV or STIs in our community.
How has the attitude toward places that do what you do shifted over the years?
Well, there's been some change in the attitudes of not necessarily acceptance, but understanding that these organizations are needed to provide testing and education and treatment if needed to members. There's still a lot of stigma around organizations, labeling organizations such as us as just an AIDS organization.
Why do you think that is?
I think a lack of education, even though we're not in the 1980s when HIV/AIDS were first came out.
And people were dying.
People were dying. It was a guaranteed death sentence back then, but we've advanced so far where it's not. People can live a long, healthy life once they're diagnosed with HIV, but still a lack of education, and it's not in the news as much because it's advanced so much, so people forget about it, and when they hear HIV/AIDS, they just flash back to when it first came out in the 80s.
So it's a kind of, oh yeah, we've already conquered that. I've seen the ads for the medication, no big deal.
Exactly.
But it is a big deal because the numbers are going up, especially in certain populations like 55 plus. To what do you attribute that?
I attribute that to, again, still a lack of education. When we think of, in the context of aging and health, we think of heart disease, mobility issues, diabetes, and how we can control or prevent those from becoming or hampering on someone's health. We don't necessarily think of sexual health, but we don't necessarily, healthcare providers don't necessarily have the same conversations with a newly single 40-year-old. That conversation is different than a newly single 65-year-old.
Right.
And we are seeing an increase in STIs and HIV in the 55 plus population. According to the Centers of Disease Control, between 2014 and 2018, we saw an increase of STIs by 23% in people aged 55 and over. Again, according to the CDC, in 2022, there was approximately 3,700 people aged 55 and over newly diagnosed with HIV. That accounted for almost 9.9% of new diagnoses in the United States.
That's a big number
Yep.
when we're talking about. So what is the problem?
Protection. As people age, As people age, women think they're postmenopausal.
Yeah, past the point where you have to worry about pregnancy and all of that.
Yes. So while that may have been a primary concern to have a partner use a condom, at that age they don't think they need to worry about it. Same thing with men. I can't impregnate someone. Why use a condom? And because of the lack of using protection leads to the spread of disease.
And what kind of problem does that create? I know you can't speak for the medical community, but the spillover into the services you offer for people who may have been infected but didn't know it or didn't do enough early enough.
Well, it definitely impacts their overall health. As they age, people's immune systems are weakened, so it's harder to treat that infection. And if they don't know about it, because people with certain STIs, chlamydia, gonorrhea, even syphilis, at times they're not displaying signs and symptoms, so they don't know they have disease. And as they stay sexually active, they are spreading that disease to others.
So what would you, what advice would you give someone who's in that 55 plus group, who's sexually active, but may go, well, I don't want to know, I'm feeling fine, it's all good?
Have the honest conversation with their healthcare provider. When you're talking to your healthcare provider about your overall health, sexual health is just as important. So have that honest, open conversation to get routinely tested if you are sexually active. Also, wear condoms. Encourage your partner to wear condoms if you are sexually active.
Now, you would think you would be having that conversation with someone who's much younger, and yet you say it's an education issue. So if there were 3 things you would want the population to know about how these numbers are going up and what they can do to bring them down, what 3 pieces of advice would you give?
The first one is sexually transmitted infections do not discriminate based on your age. So everyone needs to protect themselves. The second is to educate themselves. Learn about the different diseases, what the signs and symptoms are. In case you are exhibiting those signs and symptoms, you can seek treatment.
Okay.
And the third is to get routinely tested. That is so important to identify if you do have any disease where you may not be showing any signs and symptoms. So talk to your healthcare provider about getting routine testing.
And do you all do testing?
Yes, we offer free rapid HIV, Hep C, and syphilis testing at Hope and Help. And we also go in the community. We take the test to where the people are. We go into the community and offer that testing at different locations.
And so someone can find out if there's a location near them that partners with you for the testing.
Yes.
You said there's still a stigma, people not wanting people to know, but can they come in privately to your organization and have that done?
Yes, anyone can walk in. We don't do appointments at our headquarters location. Anyone can walk in at any time Monday to Friday between 8 and 5 and get testing. We see that a lot. We actually had one person I saw come in with a suitcase that just got back from a trip, walked in and got tested so she could know her status.
So I went away, I had fun, now I need to make sure I'm okay.
Yes,
Okay.
absolutely.
Thank you so much for being with us and for being part of the education that we need to keep ourselves safe and have fun at the same time.
Thank you.
All right. We'll be back right after this. Don't go away. There's often a false sense of security around whether you could ever get a sexually transmitted infection. But as we've heard, the numbers are rising. So it's up to you to take care of yourself so you can have healthy connections.